Dr. St. Surin Lord is a fellow of the American Academy of Dermatology, as well as the American Academy of Cosmetic Surgery and the American Society of Dermatologic Surgery. She serves as an assistant professor of dermatology for Howard University, and has been a sought-after speaker at national conferences. She also shares her expert knowledge in professional publications. Voted a top doctor in the DC metropolitan area, Dr. St. Surin Lord's philosophy is that each patient should leave her office feeling better about him or herself. Thank you, Doctor, for taking time from your busy schedule to do this recording with us. How long is each treatment? How many treatments will I need?
Okay, that's an excellent question. We actually get that a lot. Coolsculpting, I love it. 1 hour, 60 minutes. Sometimes treatments can be as little as 45 minutes as well. And so here's the wonderful thing about Coolsculpting. You place the applicator on, you put it on the site, you leave it on for an hour. Our patients watch television when they're getting Coolsculpting done. Some actually catch up on their paperwork, some take naps. So whatever you can do for an hour, you can get Coolsculpting done. And that's per site. So let's say you were doing your love handles. Well, we wouldn't treat just one love handle. So the right love handle may take an hour and the left love handle will take another hour. So you might be in there for like 2 hours. Now the chin, the Cool Mini, is what's so wonderful. We think of the chin and the chin fat. Well, guess what? 45 minutes and you're out. So that's pretty wonderful. Coolsculpting tends to require one treatment, but that depends again on the person. The one thing about cosmetic procedures and cosmetic surgery is that no two people are alike. Everyone is different, so what we use, the pieces we use are going to be different. Everybody's fat is distributed differently, so the body contouring portion of the Coolsculpting really depends on the person. Some people do need more than one treatment if there's more fat. Let's say one has an abdomen, right? Your abdomen is, you have the stubborn belly fat, but if it hangs a little, if it's not just protruding out, but it hangs a little, you probably need about 2 treatments to really get that abdomen down. And what I find is that my patients are like, okay, great, it worked, it's great, but I want more. And that's okay. If you want more fat reduction, we can do more Coolsculpting. But, you know, it depends on the amount of fat that's there, the fat distribution, and again, the patient. But pretty much a lot of times we can get it with one treatment.
When will I see results?
Okay, so when will you see results? That's what everybody wants to know, right? When we have something that we want to get rid of, we want it off now. We want it off right away. Even if we've had it for like 10 or 15 years before we saw the doctor, we want it off right away. Well, here's the thing about Coolsculpting that's wonderful. By the 4th week, one should see a difference in how the clothing feels. So if a man comes in and he gets Coolsculpting for the love handles because he doesn't like the way it hangs out from his shirts, right? He's going to notice that his pants feel a little looser. So that's what we tend to see at about the 4th week or the first month. Around the 2nd month or the 8th week is when we actually start seeing a difference. It's not only that the pants are looser, the pants may actually start falling off now. And what's really funny, I have patients who say, oh, my underwear's falling off. I can't keep my underwear up. Well, guess what? The fat that was holding the underwear up is no longer there. So the underwear are falling off. So it's a wonderful thing. We get to go shopping for new stuff, right? Now, the best results after having Coolsculpting are attained at the 3rd to 4th month. So that's when you're going to see the maximum result. Because remember, this is a natural way of removing fat. It's a gradual fat removal. But you can see results as early as 4 weeks. Now, here's the caveat. My patients who get Cool Mini, a lot of times by the 2nd week, they're already seeing a difference. And that's the Cool Mini that we use for the chin fat. And that is amazing. You never expect it, you know, and you don't promise it, but to see it when a patient follows up, that's very gratifying, and the patients are excited. I've had patients who come in for their 1-month follow-ups because I like to see my patients at 1 month and 4 months post-procedure. And at the 1-month follow-up, I'm like, oh, you know, we removed some fat. I know we did. And I look at the before picture, I'm like, oh my gosh, it's gone or is dramatically reduced. That always is exciting. Remember, again, results vary because no 2 humans are exactly alike and everyone is unique, but we do see results at a decent time, in a nice early time.
I've had my Coolsculpting procedure. Now what?
Now what? Sit back, relax, and enjoy the results. Here's the thing. I'll never tell anyone not to exercise. I'll never tell anyone not to eat, healthily. I always recommend that. Do you have to do that to get Coolsculpting or to get results from Coolsculpting? No, you don't. There are certain technologies that are out there that say, oh, you need to work out every single day and drink like 12 glasses of water when you get this done, et cetera, and it'll work. There's no such protocol required with Coolsculpting. It just works. You put it on, you sit for the 60 minutes, you let the instrument freeze the fat, we take it off, give you a nice little massage, and you go about your business. Of course you want to work out, because remember, diet and exercise shrink fat cells. They shrink the fat cells. This is why when you stop exercising, one may notice a little more weight gain, or that they're closed or a little tighter, because you're not doing the diet and exercise that shrinks the fat cells. Coolsculpting is different. It freezes them. It destroys them. They're gone. So if you do exercise and you have a healthy diet, well, guess what? Not only did you remove 25% of the fat cells, they're dead, but the remaining ones, guess what? You're going to shrink them, and you're always going to get a better result that way. But once you get Coolsculpting done, relax and enjoy the results. Behave, and you should get great results. And if you already know going in that, an area of your body is a little more stubborn, or it's going to require more work because it's larger, and you know that you're already going to need 2 sessions, and we discussed that at the time of consultation, it's okay to come in before the 4 months and before the 3 months and get that second session. So there is an interval by which I would bring my patients in after having their initial treatment and say, okay, this is time for the second treatment, because we already know going in that we're going to need more than 1 treatment. So basically sit back and don't worry.
Do I need to take special supplements or follow a strict diet and exercise program?
No. Again, as we said with Coolsculpting, there's no strict diet or specific regimen or exercise regimen that needs to be followed. But of course, having a healthy diet, a balanced diet, definitely helps with your results, because that shrinks, that keeps your fat cells nice and at a decent size. And of course, exercising reduces the size of the fat cells. Coolsculpting already destroys them, so there's no need for that. The other thing I get a lot of questions about is, do I need to do anything special or wear anything different after Coolsculpting? Unlike your more invasive procedures like your liposuction, you do not need to wear a garment. Those procedures may require wearing a garment for 6 weeks post-procedure. With Coolsculpting, there's no need for a garment. Some of my patients say that, when they work out, if they have the discomfort there or the numbness that's sometimes associated with Coolsculpting treatment, that it helps if they put on their body shaper. Well, that's okay. If it helps you, definitely do that, but you don't have to. There's no special cream that you have to rub on yourself or anything. And there's no post-Coolsculpting care that's necessary. There's no post-Coolsculpting care protocol. Again, because it's a natural procedure and it's non-invasive and there's no downtime, you can really go back to living normally as you did before Coolsculpting. Now, if you live normally with absolutely, not the best diet, that's not recommended. You can always, modify your diet, bring in exercise after Coolsculpting. That's always a plus. I actually have patients who getting Coolsculpting has motivated them to exercise. It's motivated them to adopt a healthy lifestyle. They see the change that the Coolsculpting has done, and they say, oh my God, if the machine could do this, imagine what I could do if I did it in conjunction, with the treatment that I'm getting. So there's nothing required, there's nothing special required post Coolsculpting or even before. There's nothing that you have to do to get ready for the procedure. You just come in, you get it done, and you can start on looking the way you want to look. You can be the you want to be. You can get rid of that stubborn fat or the mommy fat or the chin fat. But there's nothing that you need to do to prepare for it before then.
What happens if I gain weight after my Coolsculpting procedure?
Okay, well, we definitely don't want anyone to gain weight after the Coolsculpting procedure. You've invested your time, you've invested your funds. You want to kind of protect your investment, but you know, life happens, right? And what's wonderful about Coolsculpting is it's been FDA cleared since 2009 in the United States. So there are a lot of before and after pictures that are available. There are a lot of there's a lot of research available on Coolsculpting because they do so much research. They've been able to get more treatment areas indicated. Like before, when it started, it was just the love handles. Well, now we have the abdomen, we have the chin, the outer thigh, the inner thigh, and all sorts of other areas of the body. So with Coolsculpting, what the research has shown, if one gains weight, remember you've removed 25% of the fat cells that occur in that area. So if you get your lower abdomen treated and you've gotten a nice result, you may not see the fat gain from, let's say, a 10, 15, 20 pound weight gain. You may not see it where you got the Coolsculpting treated. You may see it in another area where you already have additional fat. What happens when you gain weight is those fat cells have to go somewhere. They're going to look for somewhere where there's fat that's welcoming to go to. So where you've had Coolsculpting treated, imagine that you're looking for a hotel room, but there's no vacancy there. So you got Coolsculpting on your abdomen. Guess what? New fat cells. There's no vacancy in the abdomen. If you got Coolsculpting in your love handles, guess what? Extra 20-pound weight gain. There's no vacancy in the love handles. Where is there vacancy? Well, guess what? We never treated that bra fat. It may go there. So the thing that one has to realize, no matter what procedure you get, whether it's invasive, non-invasive, whether it's Coolsculpting or liposuction, if you gain weight, the fat has to go somewhere. And it will most likely go where you have more fat cells. So I hope that answers the question.